Hello, hi, I'm Nelson Dafe. I'm here in Ward 6, Itoham Grammar School. I am here with the Press Secretary of Ikpoba Okha local government area, and we will be discussing Mr. Ewere, and we will be discussing the local government's response to the coronavirus crisis pandemic that has shaken the world to its very foundation. And we will also be touching on some of the salient issues in politics as regards the upcoming Edo State governorship election. Mr. Sosa, where are you welcome?
Thank you so much, Mandela.
Okay, let us quickly kickstart with the latest news that we got. That Ikpoba Okha local government is one of the three hotspots alongside Ewere and Ewere local government as far as the number of reported cases of the coronavirus is concerned in Edo State. How effective do you think your local government has been in fighting the pandemic so far?
Well, I want to thank you for this opportunity to once again address the public on efforts we have embarked upon so far to stamp out this deadly disease in our community. Ikpoba Okha is a thickly populated area. It used to be Ewere. Some years ago it was carved out and it became Ikpoba Okha local government. So that aside, the pandemic, I must say that it has actually altered global plans, especially at the global community, for which Ikpoba Okha falls in. But we cannot say, especially as a government, that yes, we have the state government fighting it in its own right. We have the federal government, so let's just relax now. I think the Ikpoba Okha local government is the first local government that distributed hand sanitizers in the entire Edo State. As soon as the news, at that time it hadn't even come, but we were only hearing about the news that the coronavirus, it appears is in Nigeria, it appears is around us. So the chairman has some engagements with some stakeholders, and we distributed over 750 hand sanitizers, alcohol-based hand sanitizers. And apart from that, we have also trained over 600 health experts across the local government. And just last week, Thursday, the council chairman flagged off 10 screening centers, COVID-19 screening centers, across the local government. In this ward where you are in currently, we have 2 screening centers. We have at School of Health, we have at Winners, we have one at Ute in Ward 1. We have a screening center in Ward 2. We also have in Ward 3 in Ewere and Ogbeson. And in Ward 4, we have in Aduawa Primary School. In Ward 5, we have a screening center at St. Xavier. And in Ward 6, we have one at Winners and we have another one at School of Health. In Ward 7, we have at Children Welfare on Welfare Road. And in Ward 8, we also have a screening center at Egba Community Town Hall. In Ward 9, in Ward 10, we screening centers all over the place. Meanwhile, before the flagging off of these screening centers, the local government had already established our own screening centers. Just mini screening centers where people can go and get screened. We don't test in Ikpoba Okha. We don't test. We can only screen and we advise. So when you see that people are gathering in places, we try to disperse a crowd that is more than 20. You can see our markets now in Ward 6. This is Itoham. This is Santana and Gomez markets established here. You can see the discipline here.
I would like to pick on the lack of testing centers. You know, that has been a global challenge. Yes, the lack of testing centers here in the local government.
No,
is that a big worry for you?
It's not a big deal because we have testing centers across the state. UBTH has just been certified a testing center. We have a testing center in Edo Central. So if we don't have a testing center in Ikpoba Okha, it's not a big deal. Ikpoba Okha is not that rural. It's not that rural that you cannot access testing centers. If you are going to UBTH now, in 20-25 minutes, you are already there. You can do your testing and in a few days you get your results and you know your status. So we are not worried. Far as we have effective screening centers And we have primary health centers, our own Ikpoba Okha primary health centers across the local government, where you can go and get information on your status. So we don't have a problem with the absence of screening center, of testing center in Ikpoba Okha.
Okay, there is a certain stigma associated with diseases in Africa, and Nigeria in particular. What has been the compliance level of people, like, as far as going to get themselves screened? Have you been impressed with
It's not been easy. It's not been easy to get people, because people could have wrong information. Oh, coronavirus, it kills. Coronavirus, it does this, it kills faster than AIDS, it kills faster than a bullet. People could have such information. But you and I know that these are not realities. Coronavirus is not a deadly disease. Yes, it has taken some lives. Some persons have also recovered from the disease. So what matters is early detection, early testing. And the only way we can achieve that is to continue to intensify our sensitization programs. And in Ikpoba Okha, that is what we have done so far. I've just told you that before the flagging off of the state screening centers in Ikpoba Okha, the local government already had her own in existence. We had in Ubekun Health Center, where you can go and get information. We also had at Ewere Health Center. Then we had at Ewere Health Center. In Ikpoba Okha, we have close to more than 15 health centers. And these health centers are they are in working condition since we came to office, March 5, 2018. The health centers are in working condition. Whenever you go there, you find medical experts. So we have already had 3 information centers at the local government level before the state government came to assist us.
Yeah, okay. You have been very visible all around different makeshift market centers as these secondary schools have become. Making sure that the compliance level to all the safety precautions are respected. When do you think we can see markets going back to their original abode?
Well, as press secretary to the local government, we didn't direct the market women to relocate to primary schools. We were only directed by the state government to monitor the situation and ensure that the level of compliance of the market women is very, very high, and that only essential commodities like food and drugs are allowed for sale. So I cannot tell you this is when these women are going back to their markets. But what I can only tell you is that in Ikpoba Okha, the level of compliance of the market women, especially as it concerns observing the various precautionary measures, which includes hand sanitization, the washing of hands with soap and running water, wearing of face masks, keeping a social distance, and other kinds of precautionary measures, has been adhered to very seriously. And that is what we continue to do here.
I just want to get your opinion on something that has been somewhat of a touchy issue. At the onset of the outbreak of the disease here, a lot of people were expecting, as part of palliatives, that governments at the federal, state, or local government levels could, make some financial fiscal provisions to people directly to their bank accounts, and there were rumors all over the place that would be done at some point. But up till this moment, that seems it's not feasible now. Why do you think it is impossible for government here in Nigeria to?
Well, I think that has to do with national policy. It has to do with policy. Governments at different levels in different countries per se has policies. Although it would be a good one if people had woken up to receiving credit alerts in their phone, it would have been a brilliant idea. However, countries have policies. I think the most important thing is to see that the government of the day is fighting the disease head on. Even if such money had been paid in the advent of this COVID-19, I'm sure a lot of families would have long exhausted that money. And they still would have had victims, possibly dead victims, even with that money from federal government. So where we appreciate the need for a possible crediting of people's accounts, what is most important is that the government is fighting or seen to be fighting the disease. And you and I can agree that to a very substantial level, the government of the Nigerian government and the federal, state and local government levels have fought this disease. In my own local government, Ikpoba Okha, the chairman Ewere has exhibited leadership, purposeful leadership, in ensuring that the disease does not spread across the local government area. So we shouldn't so much emphasize on the fact that the government didn't credit our accounts. We would have been so happy if we had seen that. But in a situation where it didn't come, we also appreciate the efforts that the government has put in so far in ensuring that this disease does not spread.
I would like to...
I'm sure you are aware that there are countries in this world where people are not dying of coronavirus on their streets. In the streets of New York, we have seen people die. In the streets of London, we have seen people die. In the streets of Venezuela, we have seen people die. Even in Italy, people were not advised to keep their coronavirus patients in their homes because the hospitals are overfilled. So where do you not admit those people? So if a member of your family in this regard is exhibiting symptoms of coronavirus, and you are able to ascertain that these actually are symptoms of coronavirus, keep them at home. We as medical experts, we come and take care of them. Don't bring them to the hospital. Why? There is no space. There is no space. China lost scores of souls. Italy lost souls. And these are countries that we are looking up to for leadership.
Okay,
but Nigeria, we have not had such cases. We are only having pockets of cases on a daily basis. I think in Edo State now, we have about 82. In other states, we have this number and that number. But we've not really seen people with the disease has not been able to hold us to the jugular.
Okay, I would like to follow up a little bit on that. You seem to be confident that we are keeping it largely in check. But something that is worrisome, almost every night, people check their phones and they get reports of exponential increases in the number of cases, reported cases from NCDC.
Yes.
You know, I did a report some time ago about Melinda Gates, the wife of Bill Gates, about her warning that when this disease does strike Africa badly, that she fears for the lack of proper healthcare system in Africa. She's afraid and that she foresees a situation where there will be dead bodies in the streets of Africa. Given the reports that we get from places like Kano, don't you fear, don't you worry somewhat that that is coming to pass gradually?
It's worrisome. It's worrisome. I must tell you, my brother, it's an unfortunate situation. It's really very worrisome. For what we can do as a people, especially the non-government actors, I mean the regular citizens, is just to continue to adhere to the WHO prescribed precautionary measures. Because, my brother, these are the most simple ways to solve this whole issue. Where the government are adopting superlative measures, like creation of isolation centers, and trying to acquire superlative health machines to ensure that we are able to fight this scourge. The citizens who are not too well to do financially must continue to observe simple precautionary measures. How much does it cost one to buy a face mask today? The most expensive face mask on the streets of Nigeria today can cost maybe about 200 or 300 naira. Whereas as small as 50 naira. Yesterday I saw a woman hawking face mask for 50 naira. I bought 4. I distributed the 4 to persons. So people must learn to wash their hands. Almost everywhere in town, you have hand washing spots. I'm sure you saw buckets of water before, just by the gate. We have close to 15 there, and they are all filled with water.